Welcome to our presentation on Edoxaban, a direct oral anticoagulant branded as Supexo-D. Introduced for the first time in India by Zuventus Healthcare, Edoxaban offers an advanced option for managing thromboembolism and atrial fibrillation. Venous thromboembolism and atrial fibrillation represent substantial global health burdens, leading to stroke, hospitalization, and even death. Managing these conditions effectively is crucial, especially in aging populations. Traditional anticoagulants like warfarin have a narrow therapeutic window, a variable dose response influenced by genetic and dietary factors, numerous drug-drug interactions, a slow onset and offset of action, and a long half-life. They also require frequent monitoring and dose adjustments, all of which can compromise patient convenience and safety. Non-Vitamin K Oral Anticoagulants, or NOACs, were developed to overcome these limitations. Edoxaban is one such NOAC, with a clean, well-defined mechanism, direct inhibition of factor Xa. Edoxaban is a novel, potent, and highly selective direct inhibitor of activated coagulation factor Xa, factor Xa, a pivotal enzyme in the coagulation cascade. What distinguished Edoxaban is its exceptional selectivity, demonstrating over 10,000-fold greater affinity for factor Xa compared to thrombin, resulting in precise anticoagulant activity with a favorable bleeding risk profile. It belongs to the class of direct oral anticoagulant drugs and provides consistent once-daily anticoagulation. Edoxaban has been globally approved and is currently marketed in several regions: Japan, European Union, United States, India, approved by the Central Drug Standard Control Organization (CDSCO). In India, Edoxaban is being introduced and marketed by Zuventus Healthcare Limited. Edoxaban is indicated for the prevention of stroke and systemic embolism in patients with non-valvular atrial fibrillation (NVAF), and for the treatment and prevention of venous thromboembolism (VTE), including deep vein thrombosis (DVT), and pulmonary embolism (PE). The standard dose is 60 mg once daily. Dose 30 mg is used for patients with renal impairment, low body weight, or those on P-glycoprotein inhibitors. Assessment of renal and hepatic function is essential before initiation and periodically during therapy. Edoxaban simplifies treatment by no INR monitoring, can be taken with or without food, and no routine dose reduction is needed for elderly patients. Prior liver function testing remains essential. Edoxaban stands out among oral anticoagulants for its favorable pharmacological profile and practical advantages. Like rivaroxaban and apixaban, it is a direct factor Xa inhibitor, while dabigatran targets thrombin, factor IIa, and warfarin acts as a vitamin K antagonist. One of Edoxaban's key strengths is its rapid onset of action, with peak activity reached in approximately 1.5 hours, faster than rivaroxaban, apixaban, and especially warfarin, which requires 24 to 36 hours. Its half-life ranges from 10 to 14 hours, supporting consistent anticoagulation with once-daily dosing. This once-daily regimen is particularly advantageous in enhancing adherence and simplifying patient management. Edoxaban has relatively few drug-drug interactions, as it does not inhibit cytochrome P453A4 and is only a substrate of P-glycoprotein. In contrast, anticoagulants like rivaroxaban and apixaban interact with both cytochrome P453A4 and P-glycoprotein. Edoxaban's 50% renal elimination and minimal hepatic metabolism, approximately 4%, make it a safer option for patients with renal or hepatic impairment. Additionally, Edoxaban is not a prodrug, has no food-related restrictions, and can be taken with or without meals, unlike warfarin and rivaroxaban. Edoxaban is recognized globally for its clinical utility and safety. It is included in the WHO model list of essential medicines, underscoring its importance as a core treatment in health systems worldwide. The American Society of Hematology, ASH. 2020 guidelines recommend Edoxaban over vitamin K antagonist for the treatment of DVT and PE. The American Society of Clinical Oncology, ASCO, 2023 endorses Edoxaban as a preferred option for cancer-associated venous thromboembolism. Additionally, the European Society of Cardiology, ESC, 2024 recommends Edoxaban for stroke prevention in patients with non-valvular atrial fibrillation. Zuventus Healthcare Limited conducted a bioequivalence (B.E.) study in 80 healthy adult human subjects to compare its Supexo-D 60 mg film-coated tablets with the reference product, Lixiana 60 mg tablets manufactured by Daiichi Sankyo Europe GmbH, Germany. The 90% confidence intervals for Cmax and AUC fell within the accepted bioequivalence range, confirming that Supexo-D is bioequivalent to Lixiana, with comparable rate and extent of absorption. Edoxaban has been extensively studied in various clinical trials to evaluate its efficacy and safety in preventing stroke in patients with atrial fibrillation and treating venous thromboembolism. The ENAGAE-AF TIMI 48 trial, involving over 21,000 atrial fibrillation patients, compared 2 doses of Edoxaban, 60 mg and 30 mg daily, with warfarin over 2.8 years. Both doses were non-inferior to warfarin in preventing stroke or systemic embolism, with fewer cases of intracranial hemorrhage and cardiovascular death, confirming Edoxaban's safety advantage. The ENAGAE-AF trial studied Edoxaban in over 2,000 patients undergoing electrical cardioversion. It showed that Edoxaban was non-inferior to the enoxaparin-warfarin regimen in preventing thromboembolic events, offering a simpler and equally effective alternative. In elderly patients aged 80 and above, the ELDERCARE-AF trial demonstrated that low-dose Edoxaban, 15 mg, significantly reduced stroke or systemic embolism compared to placebo, 2.3% versus 6.7% annually, with an acceptable safety profile. Similarly, the ESCAPE trial found Edoxaban to be a safe and feasible option in frail elderly AF patients, with comparable rates of stroke, bleeding, and mortality. The Hokusai VTE trial evaluated over 8,000 patients with acute symptomatic VTE. Edoxaban, given after initial heparin, was non-inferior to warfarin in preventing recurrent VTE, with slightly lower bleeding rates. Inclusion of 1,000 Indian patients highlighted its global relevance. In orthopedic surgery, the STAR-Z3, J3, and JV trials consistently showed Edoxaban's superiority over enoxaparin in VTE prevention after knee and hip replacements, maintaining safety. A large real-world cohort study evaluated the safety and efficacy of Edoxaban in everyday clinical practice across a diverse patient population. The results closely mirrored those of controlled clinical trials, reaffirming Edoxaban's effectiveness and favorable safety profile in routine use. These findings underscore its practical value and reliability beyond the clinical trial setting. Unique features include directly inhibits factor Xa 10,000-fold selectivity, offer rapid onset, favorable safety profile, no food-drug interaction. They provide convenient OD dosing, reducing need for routine monitoring. Edoxaban offers strong real-world evidence of reduced stroke and bleeding risks. With the convenience of once-daily dosing, it enhances patient adherence.